We tend to think that blood circulation in the head and face is more than adequate, but it can be a different story inside the bone marrow. Several features make the jawbones unique among the bones of the body and uniquely susceptible to developing issues with ischemic osteonecrosis. No other bone has structures like the teeth that penetrate to the outside world. All the infections and trauma that teeth are subject to mean that the jawbones end up suffering more infection and trauma than all the other bones combined. Usually those infections are chronic, leading to prolonged stress upon the blood circulation in the marrow spaces. And of course, many of the procedures we routinely perform on teeth subject the underlying bone to high stress. For example, root canal treatments for teeth with periapical infections frequently don't heal completely, even when they feel fine and look fine on an x-ray. They leave some degree of scarring, inflammation, and even bacterial biofilms on the apical surface. Extraction of teeth is also far from a benign process. We extract the tooth and leave the bony socket exposed to the elements in an open wound, a process that would be unthinkable in any orthopedic surgical procedure. Remnants of periodontal ligament left on the walls of the socket can prevent the bone from completely remodeling and filling in the way it's expected to do. Routine use of vasoconstrictors is another problem. Anesthetics with epinephrine can reduce blood flow in the jawbones by as much as 70%. In a long procedure where anesthesia is maintained for an hour or more, the lack of blood flow becomes a significant stress on the vitality of bone cells. Dr. Jerry Bucco, Professor Emeritus of Oral Pathology at the University of Texas, Houston, has done the most to systematize our knowledge of ischemic jawbone pathology.
Dr. Bucco's research on jawbone pathology is extensive, and much of the information and many of the photos in this video activity have been provided to the IAOMT courtesy of Dr. Bucco. Listen to this short clip from IAOMT's podcast, Word of Mouth, to hear more about why jawbone pathology is unique in this interview conducted by IAOMT's Stuart Nunnally with Dr. Bucco.
What makes jawbone pathology unique, or what makes the jawbone unique from other bones in our skeleton?
Well, that's something I've been putting together for maybe decades by now, but I I have a PowerPoint module where I put down 22 different unique features of the jawbones. But I think relative to this topic, one of the most unique things is that we pull teeth and we have the saliva and all the bacteria from the mouth, and it has to get into the socket, and decades later we have chronic inflammatory and low blood flow problems in those sockets. And that is not something that happens in any other bones. So another thing is no other bone really has vasoconstrictors put next to them all the time. And if you have a poor blood flow problem, that might be what sets the painful part of the patient's experience off. It's one explanation for the person who comes in for an occlusal restoration, and then they call a day later or 2 days later and say, my jaw really hurts now, and it didn't hurt before I went to your office. This would be one explanation. They were borderline blood flow patients, and that's another very unique thing. The inferior alveolar artery in the mandible has been studied pretty extensively in cadavers as well as a few surgical cases or papers. And it's amazing we even have a jaw because the mandible in particular, it's the arteries are routinely, as we get older, they're constricted, they become tortuous. Some of them become fibrous scar tissue. There's no blood in them at all. And I've seen, even in living people, cases where there was no artery at all, and yet they think they're fine except for this pain in their jaw.
So they still have apparently an intact nerve.
There must be collateral nerves that take over the job because they they have the normal neural sensations. When you give them a mandibular block, their lip will go numb. And the blood vessels, the corollary blood vessels, must also fill in for the work that was being done by that big artery.